Welcome, everyone, to the first installment of the Spring 2023 Virtual Reality Speaker Series, which is brought to you by the SMFA at Tufts Virtual Reality Certificate Program. Throughout this semester, we've invited leading thinkers, practitioners, researchers, and designers to share their expertise in VR and to engage in conversation about where VR might be headed. My name is Sarah Biggers, and I manage SMFA's Continuing Education Division. I'll be guiding us through this exciting Lunch and Learn event. So on the docket today, we've got three incredible panelists and speakers whom I will introduce here shortly. We'll then hear from each of those folks about their area of interest in VR. We'll discuss a few questions with our panelists, and then we will open it up at the end for a quick Q&A session. So definitely have your questions ready to go. So first up, we're going to be hearing from Trent Simmons, who is a PhD student at Northeastern University, who also directs their XR initiative. Trent's research surrounds social interactions and rehabilitation applications for VR. Following Trent, we have got Tufts' own Nancy Baker, Associate Professor in Occupational Therapy. Nancy's research surrounds a very interesting and relevant topic, which is managing chronic pain with VR. And last but not least, we'll hear from Aubrey Simonson. Aubrey teaches interactive programming in the SMFA Virtual Reality Certificate Program, is an accomplished VR interaction designer, and is also currently working with Nancy on that same VR research. So now I'll let the experts take you a little further into the metaverse here, and I'll hand it over to Trent Simmons to get us started.
Well, thank you very much for having me and showing up, everyone. My name is Trent Simmons. I'm currently a PhD student at Northeastern University in Boston, and I'm studying human movement and rehabilitation sciences. I'm also the director of Northeastern's new XR initiative, where essentially we are focusing on combining the domains that exist over all VR and AR applications and really trying to integrate them into a more collaborative workspace at the university. One of our core, principles of the initiative as well is that we really want to provide benefit in each of the domains of VR and XR, whether they be health benefits or productivity benefits, or the endless applications that are available with this technology. So that kind of leads me into my interests specifically about about VR, which is in my research. I am trying to understand how social interaction within a virtual space is actually affecting the biological behaviors that we all kind of do, autonomically and consciously in everyday life, but how those are actually changing when introduced with a social element. The reason I choose to use VR for something like that is due to the ecological validity of the platform. It's very, very nice for controlling any kind of scientific study that can be massively reproduced when you can control every single aspect of the environment, which VR obviously allows you to do. Now, when you're introducing a social presence into a virtual environment, it's not completely understood how much that affects, the person who is perceiving that social presence. That is part of my research and what I'm attempting to understand. So what I do is I create games and experiences in different kinds of simulations that introduce social presence in a variety of different ways, whether that be a low resolution avatar with just merely hands and a head that is controlled by an individual, or a fully fleshed out body with higher resolution facial features and different kinds of dynamic stimuli like that, to try to understand how the perception of those stimuli actually impact you on a much more fundamental level. And so what I'm finding in my research, which is very nice, is that it mimics real life in a variety of different ways. But the one thing that VR does allow you to do is it allows you to take a step further in terms of actually documenting some of these different metrics, because what VR can do for you is it can allow you to integrate different sensory observing technologies like eye tracking and movement tracking, as well as different kinds of EEG and sensory devices like that. So what I'm really trying to foundationally set up with my work is the use of VR for extremely interactive health benefits, as well as different kinds of social engagements that are fun and interactive for everyone, because that is obviously one of the very core benefits of VR, is that you can make things into games that everyone can join and enjoy and have a really good time with. That is essentially my background. Where I hope to go in the future with this is I would like to get my PhD and then take my work out into the real world and start designing really fun and novel educational or health-based protocols for integrating virtual reality into our everyday lives as the technology develops and becomes cheaper for everybody to afford. Right now, obviously, headsets are a little bit expensive, but technology is getting better every day, and hopefully one day soon everybody can have one in their home and we can all enjoy the benefits of that. So Nancy is going to speak a little bit right now.
I'm very glad to be here. Thank you very much for inviting me. I want to give just a little bit of background on how I sort of came across VR. I think I'm one of the people who came for it through a back door rather than as my primary interest. I am trained as an occupational therapist. I trained at Tufts many, many years ago. And in the course of my career as a practicing therapist, I started to work with individuals with chronic pain. These were individuals mostly who had been injured on their workplace, and the pain was preventing them from pretty much doing anything that they wanted to do. It was very hard. They were very unhappy. And I treated them in a variety of ways, but found that it's very difficult to work with individuals with a chronic pain. After a period of time as a practicing therapist, I became interested in going back to get my doctoral degree. And I got my doctoral degree in basically studying chronic pain, particularly with an interest in ergonomics. So I started to do research in ergonomics and research in chronic pain, trying to identify different ways that I could help to improve people's lives, help to improve the chronic pain. And it was very interesting. And I did this for quite a while. Then about 8 years ago, I was at a conference where I went purely by chance into a talk on virtual reality and pain. And I was absolutely astounded by the information that came from this group about how they were using essentially three-dimensional videos to reduce pain in individuals with chronic pain of all types. And I thought about this for a while. I didn't immediately start working in this area. I thought, okay, that sounds really interesting, but a lot of the people they're talking about are people who have acute pain, which is a very different type of pain than chronic pain. So I went with a therapist of mine who was a practicing therapist at that time. I was in academia. And I partnered with her and went out to her clinic one day with a virtual reality headset and a few of her clients who had chronic pain, just to try it out, just to sort of see what would happen. And we put the headset on individuals, and it was very, very exciting because these individuals were people who had had chronic pain for 9, 10 years. They were in pretty much constant pain all the time. They tended to move around with their body guarded, so they would hold their hands in, they wouldn't move much. They were not a happy group of people. They didn't smile much. They didn't laugh much. And we put them in the headset, and all of a sudden, they were, and this is just a typical virtual reality program. This was nothing we had created specially for chronic pain. It was actually a space station, one of the space station programs. We put them in this program, and all of a sudden they were moving, and they were moving freely, and they were smiling, and they were joking, and they were saying just how fun this was. And they came out and they said, wow, I had no pain in there. It was completely gone. And I was moving in a way I had not anticipated I would ever move. And I felt happy. All these things that we want to see happen with our clients. And I thought, yep, this is an area I've got to look at more. This is something I have to start to look at. I have to start research, and I have to start seeing how it actually works in the clinic. So since that time, I've started looking at virtual reality with chronic pain in a variety of ways. I've looked at virtual reality just as a way to distract individuals with chronic pain. So I've been doing some research where I have put people into virtual reality systems and seen how it's changed their reports of pain, how their reports of fatigue, their reports of affect on a very short-term basis. So I've been doing some distraction research. I've also been working with my clinical partners to put virtual reality out in the actual clinic. So we're actually doing studies where um, individuals who are coming for therapy have VR as part of their therapy, and not the only therapy, but part of it, and integrating that virtual reality into their therapy program. Again, with very good results. The individuals are coming to therapy and stating how much they enjoy it, and even more importantly, they're coming back, because a lot of times people in chronic pain therapy don't come in for therapy because it's so hard for them. Um, I am also starting to do some work, and Aubrey will talk a little bit more about this, in looking at some of the unique aspects of virtual reality in chronic pain in terms of embodiment, which is how we can use the simulated um, simulated body in VR to manipulate people with chronic pain to help reduce the pain in affected limbs. So I really see virtual reality as having multiple possibilities as a therapeutic medium for chronic pain and for other disease problems as well. I'm focusing in pain, but I know there are other people who are looking at other diseases where VR can have I think, tremendous influence and tremendous therapeutic benefit for individuals with various diagnoses. So right at the moment, I'm currently working on several projects. I think there's a great future in virtual reality for it as being a therapeutic medium, and I hope to be able to discuss that a little bit further as we talk in our panel. So Aubrey, I guess you're next.
Hi, thanks so much for inviting me. I am Aubrey Simonson. I'm a VR interaction designer and researcher, so I focus on the technology itself. I did a master's degree at the MIT Media Lab from 2019 until 2021, in which I focused on novel interfaces for virtual reality. So I was looking at tools for selecting things, moving things around, and carrying objects with us in virtual environments. Equivalents of things like having a mouse or having menus on a laptop, but for VR. Since then, I've been teaching at Tufts, doing research at Tufts and Northeastern, TAing at MIT, and I'll be starting a PhD at one of a number of institutions next year, which I'll know in a couple of weeks. Trent, I would love to connect more about the work that you're doing on social presence in VR. A lot of the work that I'll be doing in the next 5 years is on social co-presence. So as someone who is a domain expert in virtual reality, but not a domain expert within healthcare itself, I find that there's a lot of interesting work to be done at the sort of interdisciplinary intersection when people from domains that aren't VR approach me to collaborate. As a technologist, I try to go out of my way to not have this technology and see it as the potential solution for all problems and try to enter into domains where I don't really know anything. And instead wait for people from those domains to say, hey, I know you know how to do this thing. Is it potentially relevant in this location or in this application? And to go, well, maybe. And to either say, from what I know about this medium, probably not. Or from what I know about this medium, it could be useful and we should try it. One of the more recent instances of this happening is a project that I'm currently collaborating with Nancy on. This is one in which we are repeating mirror box therapy in virtual reality. Mirror box therapy, as I've gathered in the last couple of months, is a technique for treating people with complex regional pain syndrome that's also sometimes used in phantom limb and some forms of stroke rehabilitation. So for folk with, Nancy, feel free to correct me if I get any part of this wrong, because it's not technically my domain. For folk with various forms of upper limb pain of only one limb and not the other limb, this therapy involves having people put the affected limb inside of a box. The box has a mirror on it. They put the unaffected limb on the other side of the box, and they look into the mirror. They then move the unaffected limb and see a hand moving about where the affected limb is, and this reduces people's pain because their brain goes, well, it seems like that hand moves without any kind of pain. It's wild to me that that works, but apparently it does. And so the project that we're working on is taking people's hands in VR, taking all of the motion position that we get from one unaffected limb, and mirroring it to the location of the affected limb. Basically exactly what people are doing in mirror box therapy, but rather than it being their hand is inside of a box and the illusion breaks if you look inside of the box or move your head in the wrong way and notice this is just a mirror, creating a much more immersive illusion that's still there if you look in the wrong direction. Yeah, I think that's a bit of an intro to me and my work. Shall we pass it on to questions?
Wonderful. Thank you all so much for sharing in your areas of expertise. Just a little bit of a sneak peek, really quick little intros, but I'll get on to our discussion here. So each of our panelists here, feel free to chime in with the questions as they relate to your research or teaching area. So our first one up here actually gets at what you were mentioning, Nancy, but we've heard from you all about the ways you're exploring VR using for therapy and healthcare. Perhaps beyond what you're studying, where do you see there being the biggest ongoing areas of opportunity for VR to be used in these ways or in new transformative ways, things you've kind of dreamt about?
I mean, this is an area that I think there are numerous different ways that VR can be used therapeutically. The most simple, at least in my areas, is distraction or engagement. Just the opportunity to engage in different activities can be very therapeutic. But I think there's a lot more that VR can do that you can't do in a regular, typical space. One thing is this opportunity for people who need desensitization of some sort. So people who have PTSD, certain types of fear in psychiatry. I know they're using or can use VR to create spaces where people can practice, where they're afraid, and practice in these areas in really a very, very safe space, because nothing can harm you in virtual reality, and you can do a lot of continued exposure to problem areas getting progressively more scary, with always this option that you can end the session if it becomes too much. So that's an area that I think is really useful. I think also the idea of using therapy to enhance other types of useful therapy. There is quite a bit of study being done right now using VR to, for instance, be used with individuals who are trying to learn different skills. And so the skills are taught through the VR rather than through normal media. Exercise programs tend to be much more engaging in a VR environment, so people are using them as places to exercise in, and finding that people will exercise longer and more intensely than they would in a typical environment. And I think this whole mirror therapy idea is an area that you couldn't do any place except in VR. This idea of embodying somebody into a new body or a new space as a new person, you can't do it very easily elsewhere. And so VR is this tremendous opportunity to allow us to manipulate the environment to support what people need in order to get better.
Trent or Aubrey, if you had anything to add.
So my work primarily actually deals with an autistic population at the moment. So what Nancy is saying is incredibly important in terms of the manipulation of the environment to fit the population that you're trying to develop whatever the application for. That is one of the primary benefits that VR allows you to do. But the research on the legitimate applications of VR is, currently in development. But there are three things essentially that, in my opinion, we know for absolutely certain. Anything to do with high repetition is incredibly good for VR, so that it involves things like physical therapy or certain psychological therapies. Anything to do with risk, so it obviously an entirely safe environment. So there are really, really beneficial PTSD and phobia-based studies that are extremely beneficial that you can do in VR. And then the last one, of course, too, is the engagement of the person. So those three core foundational things are what we know for certain that VR can be used for applicationally in a clinical setting, which obviously lend to the immediate tendrils off of that, which is the the physical therapy, because obviously repetition and getting immediate real-time feedback in physical therapy without the need for somebody to stand right there and correct your posture, give you notes is incredibly important for that. Also very cost effective, a virtual watcher instead of someone who costs $100 an hour to watch you. But long term, I really think that expanding this, like Nancy said, into things like the development of workplace training, or even more very sophisticated things like learning inside of a classroom, is really where it could go.
Absolutely. I think to add on to that, I think that the domains where right now with the technology that we have, it's most useful is in physical therapy. And specifically, I think Nancy didn't get into the as niche details as we could, but used as a distraction technology for reducing pain or short-term pain management, it's been remarkably effective. This is largely just because it is an incredibly engaging medium and people have a limited quantity of attention. If you're attending to a very engaging medium, you simply cannot pay attention to the pain that is occurring to you. I also want to mention, I think the one domain in which it has been, people have attempted to use it over and over again for the history of virtual reality, and is the only one in healthcare that seems to really not be working. Since sort of the second wave of VR in the 80s, there's been interest in using virtual reality to train specifically surgeons and other people in these sort of like high intensity, high skill areas of medicine. And it makes a lot of sense that people would want to do it, because learning how to do surgery is something that we refer to in VR as DICE. It's under being either dangerous, impossible, expensive, or counterproductive. It's basically the stakes are very high, and it'd be nice if we could do a huge number of repetitions that don't require any physical materials. And it's one thing that hasn't worked out particularly well, because the haptic cues required from it need to be of incredibly high fidelity. And the haptics are the one thing that's not really there yet.
That's very interesting. Also, a little peek into our next event, which is educational applications, so training and education. Thanks for that, everyone. So kind of a tag on to that question, but do you all see kind of in the future VR becoming part of the standard toolkit in healthcare? Will it be, part of everyone's visit going forward in healthcare settings?
I mean, yes and no. I mean, nothing is in everybody's standard toolkit, because it depends on the goals of the therapy. It depends on what you're trying to accomplish. But for certain therapeutic goals, absolutely. Desensitization, engagement. I could see it as a way to train people. In occupational therapy, a lot of our focus is on helping people to retrain when they've lost capability due to some sort of disease or disorder. And they need opportunities to train them in safe places on how to do things they did before. And I could see that this could be a place where you could provide training for individuals. It's a great place for cognitive retraining. If you're talking about people who are having trouble planning or thinking, you can give them problems and puzzles in here that would be very engaging. I mean, there are numerous ways it could be used, but it would depend on the goal. I mean, as Aubrey was just saying, I could put somebody in here. Let's say I was interested in knowing if somebody could go home safely. I could put them in VR and I could have them trial some things, and they would show me at least a general sense of safety. But until I actually put them in the real environment, I would be a little uncomfortable saying that they would be safe, because there are differences between what you can accomplish in the real environment and what you can accomplish in the VR environment. So, it has its place, just like any therapeutic tool.
Yeah, just to kind of add a little bit onto that, I think Nancy is spot on. It's a tool. It should be applied wherever it can be most effectively utilized. One place that I think we haven't discussed yet, which is actually on the more preventative side of healthcare, is in terms of using VR to gather biometric data. That's ultimately a very generalized metric. A lot of my work has to do with that, using different kinds of motion capture and sensory type data to actually gather baseline information on a person's like physiological state. So in a way, that could become a more regular part of a standard trip to the doctor. We'll say that is not a strictly therapeutic style type of application.
Absolutely. I think the other thing that's sort of interesting about this is compared to a lot of other forms of especially long-term and ongoing healthcare, VR has gotten remarkably cheap. So the Quest 2 right now is a headset that features hand tracking and is relatively portable, small, robust, easy to work with, etc. And they're only about $400 now. So compared to like ongoing recurring therapy sessions, which for a lot of different types of things are not covered by many types of insurance, it's started to become something that is really cost effective for people. And the fact that increasing the number of repetitions with which you use it doesn't increase its cost can make it really, really useful for all long-term and ongoing forms of therapy.
I think it's also important to note that there is a difference between therapy and just playing. So it should be, and it should be how it can be incorporated as with therapists in a therapeutic medium. I think is really important to look at too, so that it is achieving goals and it is addressing issues and problems in an appropriate way. Um, it's easy to,
Absolutely.
oh yeah, just go put somebody in a headset and they'll be great. That's not necessarily going to be the direction to go as well.
It makes good homework.
Yeah, makes good homework. Yeah, that's a great way of putting it. It makes great homework, because you can have fun doing it. I think that's an important point to put here is it's fun. And an awful lot of therapy is not very fun. It really isn't. It's pretty boring and can be kind of painful at times. And so having something that's fun and engaging, really, it's hard to overstate how important that is when you are trying to develop therapeutic applications for things.
That's great. So kind of a flip side of that now that we've established that VR is fun, do you have any concerns maybe going forward? Do you have any visions about the future of VR and applications in medicine and healthcare that make you nervous or that you would have concerns about its use going forward? Go ahead, Aubrey.
Yeah, I'm happy to jump in on this one. I do worry a lot about it in terms of data privacy and data security and things like that. I'm sure Trent is also very, very familiar with this because this seems very like close to the core of your work. But there's a lot of information that we can gather from a person when they wear a VR headset, regardless of the application that we're using it for. Being able to gather head pose position on a person for an extended period of time is relatively revealing information. And being able to gain, in particular, eye tracking data in combination with knowing what a person is looking at gives us a lot of insight into the way that they're thinking, what they're thinking about at any given point in time, things like that. Yeah, and I think within the healthcare domain, it's a little bit less concerning due to the fact that I think the healthcare domain is pretty good about going, this very sensitive data about a person is something that we should be relatively protective of, decent at handling. But it does worry me a lot more in things that are outside of the sort of more regulated healthcare domain. So thinking in particular about like apps that consider themselves to be in the wellness space rather than a healthcare product so that they like get out of dealing with FDA and further forms of regulation are things that worry me a little bit more.
Yeah. The information that can be gathered from a VR headset is really, really personal stuff. And obviously data privacy is an incredibly important topic that every person who develops for VR needs to approach very cautiously and understand the impacts of dealing with that data and the cost of doing it improperly. One thing that I potentially worry about, as a researcher who's dealing with social interaction in VR is that there's a lot of anonymity on the internet that is a very different social dynamic than I think the world was used to dealing with 30 years ago. That is going to be bumped up to an entirely different level once people have an actual body that is also anonymous to deal with. So I think the impacts of dealing more physically, visually, physically, and then when haptics come into play, it's a whole different story. But the impacts of having anonymous virtual bodies that are impacting you and presenting whatever scenario that you're engaging with them in, and that impact on you is really just not well understood. And I don't know if we're completely ready for it, but that is one thing that I do worry about.
I've talked about VR to a lot of my chronic pain colleagues, and one of the questions I get again and again is, well, won't this just be another form of addiction? mean, we have opioid addiction, and now we're giving them this VR headset where they're going to spend all their time in this VR headset being addicted to it. And how are you going to control for addiction in VR? I'm like, it's a good question. How can we make this not the end all of where they want to be, and make sure that they are engaging in their lives and not just in sitting in the VR headset. On a practical level, for me as a therapist, the thing that I deal with a lot is I don't have the programs that I need to do what I want to do. There are a lot of therapeutic things I would like to accomplish, but unless I have a person who knows how to program a VR, like somebody like Aubrey, I can't do them. And I do not have the skill set at all to be able to design anything specific. So I am at this point mostly using commercially available programs and being extremely creative about how I use them as a therapeutic tool. But that is not necessarily an issue in the long term, but it is for a therapist. If you're thinking about some of the really cool ways that VR could be used, we are definitely limited by the few people who can actually do the type of programming that needs to be done to create high quality therapeutic programs to work in. And if we do wind up with these as true therapeutic tools, we got to deal with the FDA, and dealing with the FDA is never a fun thing. So that's going to be a part of the challenge of VR as a medicine over the years, is how is this going to go through the systems, FDA system, and some of these other things that do regulate medical devices. So that's one area that we have to look at.
Great. So we have one last question here for the panelist section, and then we'll move on. We're getting some great questions in the Q&A already, but this one might be a little quicker. But with all of you, participating in various capacities in research at the university level, what role do you think universities should be playing in advancing the utilization of VR in healthcare fields?
I'm happy to start on this one. So I think that being within a university rather than doing this research from a more industry-related background gives us a greater ability to be a little bit less biased in our study design and interpretation of results, et cetera. So for example, the project that Nancy and I are working on, we're going into a study relatively soon. And if we get answers out of that study, like a mirrored hand has an extremely high level of embodiment, that's an interesting result for us. But if we get a mirrored hand has an extremely low level of embodiment, that's also an interesting result for us to continue exploring. Whereas if we were doing this study as the beginning of, say, a startup focused on creating VR experiences for treating complex regional pain syndrome, whether or not a mirrored hand experiences a high level of embodiment would be a existential question for us. So it gives us the ability to do research which is more unbiased.
I mean, I think academia, I come from the therapeutic partnering with clinicians and things like that. So I know from my experience that clinicians rarely have a chance to really research areas. They use things, but they don't really research what's going on and what's happening. And in academia, I have that luxury of being able to step back and say, is this really working? Is this really doing what we think it's doing? How can we enhance that effect to make it more effective? How does it differ with different populations? How does it differ with different diagnoses? How can we make the VR stronger? How can we make the clinical connection stronger? So, we can sort of sit in the middle of these and ask questions and study them in a way that clinicians cannot. That being said, it is really, really important that there are clinicians involved in these kind of research studies, because it's really easy to get into this theoretical, wouldn't it be great if we could do this kind of thing mindset, but without actually working with the clinicians and the patients in the field, it's really hard to know what is actually going to be feasible and workable for a therapist and a patient using virtual reality headsets. So it's sort of that ability to provide the research, but also to bring partners together to be able to study and think about these practical questions related to virtual reality.
Yeah, just one quick word on that. So feel free to disagree with me a little bit, Nancy, if you do so. But Historically, academia has been not the best place for what I would call collaboration, even though environmentally they absolutely should be. I mean, the department for, engineering or, design is, a 5-minute walk across campus. But with something like VR, it's incredibly important that you do utilize the multiple domains of the university system, that it allows you to collaborate on things together, because it is such a multidimensional platform. And if you're going to try to construct something that is worthwhile, that utilizes this technology to its fullest potential, it's going to require the collaboration of multiple experts from multiple different domains. And the universities, I mean, just geographically are set up in the best way to potentially do that, if they can all get along.
Oh, I agree with you completely. I mean, you have to have a bunch of collaborators. But what I'm trying to say is it has to be people in the field as well as in the university. That it has to be that huge collaboration of the stakeholders and the experts in the different areas all working together to understand and apply what's going on there. And that will produce products that are stunning and useful. And if we don't do that, then we're just going to create exercises of interest to the academicians without it being that useful for people out in the field who actually have to use it in the long run. But I agree with you completely. Collaboration across the board is really important.
So we're going to move on to some of the Q&A questions popping up here. We'll start at the top on my end here. So from Eileen, we have a question. If the treatment of pain with VR relies on distraction, does the effect wear off over time as people get over the novelty of the technology? And then related, does the effect on pain depend on what the VR experience looks like? For example, a beautiful and calming environment or a very engaging game activity?
That's questions I've been asking myself in some of the research that I've actually been doing. The treatment of pain, I think, is a lot more complex than just distraction. Distraction is a really important element. And I think of it more of engagement than distraction. Distraction suggests that they're still sort of aware of what's going on, and it's just sort of this thing that doesn't have a lot of meaning. I mean, you can have distraction without having engagement, and I think engagement is the key term when you're thinking about VR. People have to be enmeshed in what's going on. And yes, if the novelty is lost, the effect on the pain tends to diminish. So you have to be able to choose programs that are engaging at the right level. They can't be so complex that the person can't do them and feel frustrated, but they can't be so easy that people become bored with them or they start to lose interest with them. It also is important that it doesn't have to be necessarily beautiful or calming. Again, it depends on your goal with a person. If you're interested in working on somebody practicing calming, you might do meditation. If you're interested in just engagement, you might put them just in some sort of fun puzzle atmosphere that allows them to sort of achieve this state of flow, this engagement. So yeah, I think it does matter where you put them, but trying to figure out what's the appropriate place is going to take some work, and it will also depend on the person themselves. I mean, if you have somebody who hates swimming and you put them in a watery place because water is really cool and calming, and they are afraid of water, you're not going to do much good for them. I mean, they're just going to get upset. So there are a whole bunch of things you have to consider when you're designing or thinking about what type of environment you want to put people in.
Definitely. Great. So the next one up we have directed at Aubrey. What are some of the common factors in successful VR interface elements? What kind of accessibility problems do you run into when designing for this medium versus traditional UI?
Absolutely. So this was like the topic of my master's thesis. So trying to do this without just like absolutely info dumping is a bit of a challenge. But so wearing a headset at all, adding an HMD to anything that you're doing in your life does have a little bit of added difficulty to it. They're a little bit uncomfortable. They can have some level of eye strain. And so in general, the approach that I've taken towards UI design for virtual reality is that if you can do something with a laptop or with a phone, it's fundamentally only 2D interface items. It doesn't make a lot of sense to do it inside of the headset. Like, why did you put the headset on to do this? And And so in interface design, in the work that I did for my master's, I was focused on how do we make interfaces that take as much advantage as possible of the fact that we have access in virtual reality to practically infinite space, that you can use that third dimension. So the primary tool that I was working on is something called Bird, which is a means of controlling a point in 3D space with one hand. Yeah, some accessibility items that I've thought about in terms of interface design for VR. So we run into this difficulty where you don't have a keyboard and therefore you can't type in a traditional way. And a solution that a lot of folk have tried to use to overcome this for interacting with virtual environments is by using natural language cues, by having people speak to the headset, which for a lot of folk works really, really well. But natural language cues work significantly less well for basically any language other than English because our database is much smaller for those. The majority of our natural language models come from all of the content on the internet, and the majority of the content on the internet is in English. They also work much less well for more niche dialects and accents. And so you run into a huge accessibility problem there. Large language models and natural language interfaces pick up things that I say very, very well because I have an accent that fits towards sort of the center of what they know how to do. You also run into all kinds of interface design questions related to accessibility, related to people having hands that are easy to track. All of our hand tracking right now is done using it's a combination of cameras on the headset and AI models that look at what they can see of where your hands are and then fill in where the other bones probably are that they can't see. And this is an issue for folk who have sort of non-standard hands. So basically people who are missing digits. Something that Nancy and I ran into actually the other day, there's a VR experience where there's a number of hand cues for doing things like teleportation or doing things like most of the interface. And they have a mode in which you can specify if you are missing fingers, which of those fingers are missing, and remap to other fingers, which fingers they should be controlling. So I think that the main thing to think about in terms of accessibility is remembering as you design things that other people may not be shaped precisely like you, speak precisely like you, etc. Yeah, there's also all kinds of hardware questions in terms of like, as headsets are designed, they're very difficult to use if you have long hair or you have curly hair. They don't fit well over that, but that's the hardware itself.
Thanks for that answer. Next up, we have one in the chat as well. What are your views on the utilization of VR in dental anxiety? Very relevant.
You know that there's actually a fair amount of research out there. I did a scoping review that was looking at VR for, again, pain, but pain during dental procedures. And there's quite a bit of work that's been done putting VR headsets on people during dental practices, and it actually works pretty well. Again, you work on the idea of distraction and engagement to basically take people away from what's happening in their mouths, and it actually can be pretty effective in calming people down and keeping people more happy, including kids. I mean, a lot of these studies were done with children, not just adults, in terms of difficult procedures like dental procedures. VR can actually work pretty well for that.
Trent, did you want to jump in there? I'll let you talk on that.
One of the first applications of VR that I ever saw that was extremely effective was just this VR environment for children that was specifically designed to cope with the fear of getting like a medical shot, which was seen to just be extremely beneficial. And they would actually give the shot to the kid while they were in the environment interacting with their like fairies and something super engaging for the kids to connect with, but they would actually get the shot, and it was an extremely beneficial experience.
So the next one I was going to move on to is same idea, but how do you see VR being used in traumatic brain injury patients?
I used to treat traumatic brain injury patients quite a while ago. So there are, again, depends on the goal that you are looking at for your traumatic brain injured person. If you're dealing with the cognitive issues of traumatic brain injury, there are numerous puzzles out there that can be help them to work on cognition, thinking, sequencing, emotional control, all those sort of things that happen to people who've had traumatic brain injuries. If you're interested in more of the physical aspects of it, the person has maybe some tone, or maybe they are missing a limb, or there's some problem there, you can work on highly repetitive exercises that you can grade to make them easier or harder, match the needs of the individual who is having the problems. If you're interested in having them work on functional tasks that might help them to identify, like for work or for being able to go home or gardening or something like that, you can have the person engage in tasks that address these kind of issues. If you're looking at some of the emotional control issues that happen, again, we talked a little bit about how you can work with individuals gradually in safe spaces where they can be in front of things that might trigger them and help them to learn how to do some of that control. And I mean, again, I think it depends on what you're interested in doing. You can usually ideally find a commercial program that will let you do it, or if you're really lucky, somebody has designed a program that will really address straight on what you're interested in working on. So again, depends on your goals.
Yeah. So one specific thing that I can say where I really fundamentally believe that VR should be used in the future as soon as the science comes up to back it, is in TBI, specifically in concussion. There is this I believe the term is this rebound period. So after the TBI has occurred, there's this period of time where not too long ago, it was actually customary to just introduce no sensory stimuli at all, like keep the person in a dark room, isolated, away from everything, so that the theory was that so that the brain could heal during this time period. And what they're finding out now that's probably not the best thing to do, but what is probably best is not just introduction of every sensory stimuli that we can give to the brain, but maybe more precise introduction of specific stimuli that would actually help the brain heal and come together, bounce back in a way from the TBI. So this is something that virtual reality can do better than almost anything else because you have such control of the environment.
Great. Moving on to another one here. On the flip side of being therapeutic to the mind, how can we curb VR becoming the actual reality and leading to general disconnection from the physical world? Back to those concerns about the future.
I don't know if this is a strictly ethical panel, but I'll give it a go. I think there exists, like Nancy said a little bit earlier, this real risk of addiction that is present within all of these technologies. And the addictive component to a reality that is not the physical reality that you cannot escape, that you must live in favor of something that you can change and manipulate to be more accustomed to, is an incredibly, dreamy concept, I think, for a lot of people. So I think it's very important that from the onset, we are extremely upfront as, the producers of this technology, that this is for a purpose. This is a tool, much like the internet, it is how you use it. And this is how you use it. And also, we must provide the details on how you use it and also still maintain your sanity and your level of presence within the world that you cannot escape, rather than the one where you can.
I think I've been less worried about this because of the level of sort of mild discomfort caused by wearing a headset for an extended period of time. The vast majority of people will begin to, in less than an hour in a headset, experience something we call simulator sickness. This is a sort of like overall low-level nausea and headache that's caused by the fact that there's a tiny, tiny difference between what your eyes are seeing and what your inner ear is saying. This can be made worse by doing things like any experience where you push a joystick to walk around and therefore like experience sliding forwards, but your inner ear says that's not happening. So for most people who have not spent a lot of time in VR already, spending more than about an hour in it starts to become really physically unpleasant. And then beyond that, past that hour, even for people who have a much stronger stomach to this kind of thing, start to get some levels of eye strain, some level of just discomfort between the interface of the actual headset itself and the skin on your face. If you're ever at like a conference where people will wear a headset for a pretty long period of time, you can tell when someone has taken it off because there's an indent from where the headset was. I think the level of physical discomfort involved in really, really extended use means that I'm not super worried about really, really extended use being a very widespread problem. That being said, there are people in VR chat who have logged like thousands of hours who have just kind of gotten over that barrier. So I do think for a number of folk, it is a very serious concern.
And I think along with what Trent said is that, and what I mentioned before is that we have to, it should be linked with a therapy. It should be linked with an individual or a person who understands how to use it as a therapeutic tool, and that they link it to real life. They don't just put something in a headset and say, here, you're in a headset, go, this is just, whatever. That when you're working with somebody with VR, you take them out of them and say, okay, so here is in VR, and we were working on this goal in VR. Now, here's how it applies to your real life. Here's how it's going to make your real life better. Here's how you can use this to exist in this world better. And so it becomes the means to the end of having a better life, rather than just you're in the headset all the time. And there is no connection between what's happening here and what's happening outside that headset. So again, you're not going to, there are some people who are just going to be addicted to it, but I think you can help prevent that by making it very clear how what you're doing therapeutically applies. It is therapeutic and it applies to the outside world in this way.
Thank you all. So we're looking at time here. I see there are 2 open questions still in the chat, and our panelists are going to answer those quickly in the text platform. But we wanted to just make sure we get you out of here on time. So thank you all. Thank you for our wonderful panelists for all that you've shared. This was a really great discussion, and thank you to our guests for joining us today. As a reminder, you can stay tuned, as I had said, for our next installment, which will be covering educational applications for VR. That's coming up on April 10th. And if this session kind of further piqued your interest in VR, definitely consider checking out our fully online certificate program in virtual reality. We have a new set of those courses starting in May for our summer session, and you can learn more directly from Aubrey here and just continue to dip into this world. So there's that Go URL at the top there, go.tufts.edu/VR to hear some more. Thank you everyone again for participating.